Okay, we're thrilled to have with us this afternoon Dr. Hilary Stern. She's the founder and owner of the Exotic Pet Clinic of Santa Cruz, an animal hospital devoted exclusively to the care of exotic pets. She is also a consulting veterinarian for the Rabbit Haven, Native Animal Rescue, and Make-A-Boo Companion Bird Rescue, and the surgeon at low-cost spay-neuter clinics for rabbits in Santa Cruz County. Dr. Stern is board certified in exotic companion mammal practice. She has presented at exotic pet conferences and has published in the Journal of Exotic Pet Medicine. And she's here today to talk to us about the care and feeding for orphaned and baby rabbits. Again, please type any questions in the chat, and hopefully she'll have a few minutes to answer those at the end of her presentation. So with that, I'd like to turn it over to Dr. Stern.
Thank you. Hi, everybody. So I'm going to talk about breeding and pregnancy and taking care of baby bunnies. I think a little bit of what I'm talking about is going to touch on things other people spoke about earlier, but it's always good to go over things multiple times when they're really important. So, okie dokie, we're going to start with pregnancy and birth, just to get a quick background on rabbit breeding. I think someone mentioned that onset of puberty is really young in bunnies. So males can be fertile at around 4 months of age, and females, the small breeds, also at 4 months of age. So if you have a litter that you're caring for, make sure you separate the sisters and brothers by 3.5 months. You don't want any accidental pregnancies. In terms of spaying and neutering, males can be neutered as soon as the testes drop into the scrotal sacs. That usually happens at 3 or 4 months of age. The females, though, we prefer to wait a little longer. It's better to have them be at least 5 to 6 months old. It makes the surgery safer and faster. If we go in early, and sometimes that happens, especially when we have rescue bunnies and we don't know their ages. If we go in early, we can still do the surgery. It's a little trickier and it takes a little longer. So we'd rather wait when we have when we know the age. Now, bunnies are really, really good at reproducing. It's their major defense in the wild. Unlike dogs that might, go into heat once or twice a year, these guys have a very long breeding season. It runs from January to October. And the does, which are the females, are receptive to breeding every 18 days. So they also could get pregnant again the day they give birth. Just a few hours after birth, they're ready to get pregnant again. So given those, and the gestation period's pretty short, it's only about a month. So given all that, a single female rabbit can produce 40 to 50 offspring in a year. And since her offspring can start reproducing at 4 to 5 months of age, you can imagine that it's very easy for somebody with a male and female rabbit to quickly get overwhelmed with the number of rabbits that they have. Nutrition during pregnancy and lactation is really important. It takes a lot of calories and protein and calcium to have a healthy pregnancy. So instead of feeding the usual adult rabbit foods for non-breeding rabbits, which would be normally a grass hay like Timothy hay or botanical hay, We recommend using a leguminous hay, which would be alfalfa or clover. They're much higher in protein and calcium. And then instead of using an adult rabbit pellet, which often is maybe Timothy hay based and it's lower in protein and calcium, we switch them over to generally switch them over to a baby rabbit food, which is specifically designed for growth. So I put down the names of a few brands. Oxbow Essentials, it's called Young Rabbit Food. Science Selective, it's called Junior Rabbit. Sherwood, Baby Rabbit Food, but you get the general impression. All of those diets are going to be based on alfalfa hay instead of Timothy hay. And they have, you generally want about 15 to 18% protein for these guys. Leafy greens are always enjoyed and make a fun addition to that diet. But just as with non-breeding rabbits, you want to avoid junk food. So fruit or carrots should be given in very small quantities. And you never want to have them on those muesli diets where there's mixed in nuts or seeds or dried fruit. Those are just not good for bunnies. They're too low in fiber and too high in carbohydrates. So the gestation period, which it means the duration of the pregnancy, normally lasts about 30 to 32 days. Rabbits are pretty interesting. If something goes wrong with the pregnancy, or if the rabbit's food supplies becomes diminished, or perhaps they're really stressed, they can actually stop the pregnancy in the middle of it, and the female's body can resorb those fetuses. So she just sort of takes the nutrients back away from those developing babies and resorbs them back into her body. There's 2 times when that can tend to happen, 11 to 15 days, and then again at day 21. So it is possible for a bunny to get pregnant and then never have the babies because the pregnancy gets stopped in the middle. If something happens to the fetuses after day 21, she can't resorb those. So those would be stillborn, um, or sometime, you might have uh, her give birth to some dead kits, or sometimes they actually stay in there, become mummified. And surprisingly, that usually doesn't cause a lot of problems. I've found that as an incidental finding in healthy female rabbits. And going back to the resorption, one thing that's interesting is that it's more common in the subordinate does. So when they're outside and living in a colony, it's the dominant females who are going to be producing more young. In terms of litter size, small rabbits tend to have 4 to 5 kits, while the larger rabbits tend to have 8 to 12. And then first pregnancies always tend to have smaller numbers. Once they are through that first pregnancy, they start producing more. I don't know if anyone has seen this. There is something called a false pregnancy in rabbits. Um, it looks from the outside very much like a pregnancy. You'll see that there's memory development. You'll see the rabbit pluck the fur out of her dewlap and her belly and make a nest, but she's not actually pregnant. What's happened is she's ovulated, but the egg is not fertilized. So that can happen. Sometimes we don't know why it happens. Sometimes it happens if she's mounted by a female or an infertile male. But that generally will resolve after about 17 days. You'll even see some lactation. Sometimes they'll produce some milk, and then it will resolve on its own. When a pregnant bunny is getting ready to give birth, you'll see several days to a few hours beforehand she'll make a nest. So you want to make sure she has hay or straw, other material to make like a nice nest with. And then she'll start plucking fur out of her, under her chin, and on her belly, on her sides to line the nest. It's very interesting. Their hair actually becomes loose at that time so that plucking the fur out doesn't hurt the way it normally would. And that is insulating, that fur makes an insulating layer to keep the babies warm and also to keep them covered. Um, of course, rabbits, these used to, are descended from wild rabbits. So keeping the babies covered and warm is really important when they're living outdoors. Normally, docile does can become aggressive at this time, and it's really important to have a hands-off approach. You can, check on her visually, but give her a quiet space and some privacy because she's going to want that during this time. And if she's handled a lot or stressed out, it can have adverse consequences. Rabbits usually give birth in the early morning. It's pretty quick. Even with, if they're having 12 babies, it can take less than 30 minutes. So it's often unobserved. Usually people just will find the babies, when they check in the morning and they're already there. The doe eats the placenta and the fetal membranes and then cleans off the kits. So normally there wouldn't be any um, blood visible or any membranes around. Sometimes, especially with does on their first litter, they can become a little over enthusiastic. And when they're cleaning the babies, they may nip off a little bit of the ear or something, but generally the babies still survive and grow up fine. If a kit is accidentally born outside the nest or crawls outside the nest, the doe will not nurse it. So if you see that, pick up the baby and put her back in the nest. Make sure she's warm and active. But once she's back in the nest, the doe will nurse her. Sorry, it's keep losing my cursor here. Ah, there it is. Okay. Now, after birth, again, really important to have, watch from a distance to make sure everybody's okay. If you disturb the doe, they can actually mutilate or even eat their young. And this is especially common in young does. I've seen this also in guinea pigs. So uh, giving them some space, quiet, privacy, give them a few days to get used to the idea and get into a rhythm before you start going in and handling the babies. Because they can get pregnant immediately after birth, and it's very taxing for them to be both pregnant and nursing at the same time. You want to make sure there aren't any intact males with her right after the birth takes place. And for a different reason, you also don't want other females in there. Female rabbits can injure babies from other females. We don't want that to happen either. Okay, so now we're going to talk about nursing and maternal care. So a lot of, I definitely get phone calls sometimes where people are worried that their rabbit gave birth and she's not taking care of the babies because people are used to watching dogs and cats where uh, they see the babies nursing multiple times during the day. That's not what happens with bunnies. The doe will stay nearby, near the babies, but she doesn't stay with the babies. She'll only go into the nest once or twice a day and nurse just very briefly for only about 2 to 5 minutes. And the nursing often occurs at night. So it's very common for with totally healthy mom and babies for the owner of the rabbit not to see them nursing. So what you want to look for is if you do look at the babies, they should be sleeping, they should be warm. You don't want their skin wrinkled. If you see all of those things, like, nice and they have full bellies, the right thing is happening, and you can relax that the mom is nursing them, even if you don't see it. In the wild, where when they're nursing from their mom, they generally will sleep for about 22 hours and then just wake up briefly, climb from the bottom to the top of the nest and nurse. After that, for 2 to 5 minutes after they nurse, they urinate on the top of the nest and then climb back down to the bottom of the nest and go back to sleep. So that's the normal cycle. And this allows, rabbits eat a lot of, especially wild rabbits eat a lot of high fiber, low calorie food. So this gives the mom enough time to be going out and foraging for food to make the milk that her babies need. So scent is a very important way that baby rabbits and moms communicate with each other. The babies are born blind and they're born deaf, but they're born with a very acute sense of smell. And so they can smell their mom. And in fact, their mom has these special glands near their nipples that create a pheromone that attracts the babies to the nipples. So that's how the babies are going to find the nipple and attach and drink milk. And the mom marks the babies as hers by rubbing her chin on them and her inguinal glands, which are the two glands on either side of the perineum. She'll use those to mark her babies with her scent. And that's how she knows that they're hers. If you were to take a baby away from a mom, give it to another female, and then put it back with the mom, she could attack it and kill it if it smells like another rabbit. So I don't think it's a problem if you have clean hands, if you touch the babies, but you wouldn't want to be petting another rabbit a lot and then touch the babies, because it could be a problem. And in rabbit colonies, the does are aggressive toward the offspring of other rabbits. If they're in the same colony, they tend to harass them but not kill them. But if they are from a separate colony, they'll actually attack and kill young. And all of this is mediated through smell. Nursing, as I mentioned, the babies sleep at the bottom of the nest until they're hungry, then climb up to the top of the nest. And once they attach to the nipple, you'll see they'll actually do this kind of pushing action where they stimulate the letdown. It pushes on the breast to stimulate the milk letdown. And if you've ever bottle fed babies, sometimes you see them, their legs will be going like this, even though they're just on a bottle. In the wild, the doe will, once the babies go back down into the nest to go to sleep, they actually cover the nest for the first 18 days to provide both warmth and protection from predators. Now, rabbit milk is really interesting. It's one of the richest milks out there. And being so rich, it allows the doe to nurse the babies only once a day and still have them grow normally. And the kits are amazing. They can drink up to 20% of their body weight in one feeding, which again is very brief, 2 to 5 minutes. So it's much higher in protein and fat than, say, kitten milk or cow milk, or or certainly human milk. It's very distinct type of milk. And one of the first day or two of whenever a mammal gives birth, they have a special kind of milk called colostrum, and it contains antibodies that the baby drinks, and the baby's gut is temporarily porous and can absorb those antibodies whole through the intestinal wall. It helps keep the babies healthy. It helps protect them against um, bacteria and other pathogens in their environment. Now, in a cow, colostrum is essential. If a baby doesn't get colostrum, they will often get infections and die because they just don't have a functioning immune system yet. With rabbits, most of the immunity is actually passed to the infant before birth through the placenta, which gives these baby rabbits an advantage over, say, a cow. There is still some antibodies present in the colostrum. So if you were to get an orphan rabbit, for example, the difference between taking one that was just born and never got colostrum, that rabbit is going to be much more susceptible to intestinal and respiratory infections than a baby rabbit that got, was nursed for, say, 48 hours before, for some reason, it became orphaned. Here's a chart of rabbit milk composition, and you can see the rabbit is on the left. Rats also have very, very rich milk, but you can see compared to a cat or a cow, the rabbit milk is much higher in protein and fat and just lower in water. And it's also very low in lactose and carbohydrates. This is important because just like in adult rabbits, where eating too much carbohydrates can cause an intestinal imbalance and tend to cause an overproduction, E. coli or Clostridium or other pathogenic bacteria can proliferate. Same thing's true with the baby rabbits. You don't want much carbohydrates going into them because it can upset their balance of bacteria. Okay, so let's see how we do it on time. Okay, growth and development. We're going to go through this pretty quick. Baby rabbits are born blind, hairless, and deaf. They usually weigh about 50 grams at birth. And as I said, they do have a sense of smell. They don't start hearing things until 7 days of age, and their eyes don't start opening until 10 days of age. They're really helpless at this young age. This is a list of their developmental milestones. By day 7, they usually have light fur in their body and they start to be able to hear. The ears just start to open. Day 8 is when they start nibbling on solid foods, and they'll also be observed eating their mom's feces, and that is going to help put normal bacterial flora into their gut. So that's really important. By day 10, their eyes start to open. Day 12, their ears are open. By day 13, they no longer need heat support, and they can be at room temperature. By day 18, they'll start leaving the nest to explore their environment. And day 21, they start to eat their cecotrophs. So they have a functioning cecum where they're fermenting the food and producing all those vitamins and fatty acids they need to stay healthy. And then normally by day 24, 28, the doe abandons the young and they start fending for themselves. If you have a situation, if you're in a rescue situation and you have a mother who is unable or unwilling to feed her young, the best chance of survival for those babies is if you can get them to nurse from another rabbit. And I know that's not always available and it doesn't always work, but certainly that would be the best thing to do if possible. Now, of course, for a baby to nurse, they have to be healthy enough and be strong enough to suckle. So it may be that they might need some medical care first to get to that stage. But once they're well enough to nurse, what you want to do is camouflage their scent. So you can rub a towel on the mom and then rub it on the babies. You can rub them in the nest bedding, place them under the other babies so that the scent of their mom gets diluted out and they start to smell like the foster mother. So similarly to the lactating and pregnant rabbits, growing baby rabbits have an increased need for calories, calcium, and protein. So they're going to be on the same diet as the mom and be on a growth food. That's really important. You don't want them on Timothy hay and adult rabbit pellets. Okay, I'm going to go over raising orphan babies here at the end of the talk. I know that not everybody is going to be in this situation, but if you are working for a rescue group and you are faced with taking care of baby rabbits, it's important to have this information because even under the best, most ideal circumstances, they have a high mortality rate. It is hard for us to reproduce mom's care. So what we need to do the best, we need to do the best what we can. So they need to be kept warm. They need to be hydrated. We need to do our best to mimic the doe's milk with, artificially creating replacement milk. And then we need to be vigilant because they will be prone to diarrhea and pneumonia, much more likely in a hand-raised baby than in one that's being raised by its mom. So here is whoops. Sorry about that. Okay. Baby rabbits, they're born without fur. They really aren't able to maintain their own body temperature for the first 2 weeks of life. Now, if you had to raise a litter of 10, then they can huddle together. And if the nest is, if they have a nice nest, they may be able to keep themselves partly warm. But for sure, if you only have one or two, they're going to require supplemental heat. And it's best, you don't want to overheat them either. So it's best to create a nest and maybe put heat under half of it so they can move toward or away from the heat, depending on how they feel and what the temperature is. They've done studies where day 1 to 4, the optimal ambient temperature is 95. Days 4 to 7, it's 90 degrees. Days 8 to 13, 84 degrees. And then after day 14, for a healthy baby, they don't usually need heat support. Hydration is real important. They won't nurse well if they're dehydrated. So if you get a baby rescue rabbit and it's dehydrated and cold, warming it up and getting it hydrated are going to be the most important things to start with. The rate of fluids that they need is 100 to 150 milliliters per kilogram of a crystalloid fluid under the skin. You do want to warm it beforehand, otherwise you're likely to make them even more hypothermic than they may have been. And if needed, it can be given twice a day. So, for a baby, for 100 gram rabbit, it would be 10 mils. So it may be, 2 or 3 mils for a baby, depending on their weight. Weighing these guys is super important before you do any of these things, whether feeding or giving fluids. And in terms of milk replacement, there are a couple of companies that do make milk replacement products specifically for rabbits. One is Wambaroo out of Australia. Wambaroo rabbit milk's very good. There's an American company called Fox Valley that makes a product called Day One 3240, which is made for rabbits. But if you don't have, if you end up with a baby rabbit, you don't have those on hand, this table on the right shows you ways of mixing up um, a milk replacement that will be pretty close. So Espelec is a product for human babies, and you can add cream to it to help increase the fat and calories. There's also one here based on evaporated milk. There's a couple of recipes here based on kitten milk replacer, and you're adding in multi-milk or to add protein and fat to it to try to mimic the doe's natural milk. But again, none of these are really perfect, and they are more prone to diarrhea with our artificial milks than mom's milk. Certainly safest and easiest if the kits will take food from a syringe or a small bottle. Doesn't always, they won't always do it, but certainly worth a try. Much less likely to accidentally breathe the milk into their lungs if they're actively nursing. So you never want to force feed them. If you're feeding with a syringe, don't depress the, depress the plunger really quick. You want to go slowly and allow them to suck the milk from the syringe at their own pace. And I've seen people use a variety of different sizes syringes, and some people use nipples and some people don't. I've seen people just use like the end of a rubber tubing that you could stick on a syringe. There are some kitten teats that bunnies will take, like in this picture. Wambaroo does make teats specifically designed for rabbits. There are some wildlife, some online companies that cater specifically more toward wildlife that make nipples for baby rabbits. So if you know it's coming and can get prepared, or if you think this is something that's going to be happening as part of your rescue, you want to have those on hand. If the babies won't suckle, we're left with having to use an orogastric tube, which means a soft, small tube is passed from the mouth into the stomach for the feeding. What you want to do every time you do this is to measure, is to hold it on the outside of their body from their mouth down to their last rib, mark it with a pen so that when you put that tube down, you know you're in the right place. Because if you don't go deep enough, then the milk may come up and choke them. And if you push too hard, it could actually injure the stomach. So, and I've done this with babies and had it work well, and then also had it not work well. So this is where you start getting into the problem where you have increased mortality if you're in this situation where you have to tube feed them. The amount to feed it's important to weigh them and then measure the amount that you're feeding them. Overfeeding orphan baby rabbits is one of the most common reasons for death. It's just too much calories in their body. They may actively take the milk, but it's more than they can handle, and they will get in like a dysbiosis, a bacterial overgrowth from some kind of pathogenic bacteria. So you want to weigh them every day and then feed them according to that day's body weight. The milk replacement is not the same as doe's milk. So instead of feeding once to twice a day, we generally have to feed these guys 2 to 3 times a day to get to keep their growth on track. And so at 100 milliliters per kilogram, if you have a 50-gram baby rabbit, it's going to be about 4 mils. And then it may be up to 30 mils for larger kits, depending on the breed and how fast they're growing. Just like with the fluids, you need to make sure the milk is warm, especially when they're babies. So you're going to want to use a thermometer and warm it to 100 to 105 degrees, basically their body temperature, and keep the milk, in between babies. You want to keep it in hot water. You don't want that to get cold. The milk does need to be made up daily and should be refrigerated in between uses, or just make it up before each feeding. It's a good idea for the first few days to stimulate toileting after you feed them. You can just wipe their perineum with a moistened cotton ball or tissue or Q-tip to have them urinate before you put them back. After that, they probably don't need it and they can do it on their own. Again, don't overfeed them, even if they are enthusiastic eaters. You don't want to push them over into some kind of dysbiosis. And then starting on day 8, if you have access to the hard feces from a healthy rabbit, please start putting it in their nest where they're staying, and they'll start eating it. And that's going to help populate their gut with healthy bacteria. And then also on day 8, when you start offering them alfalfa hay and pellets, and they'll start nibbling on food. And by day 28, they generally are weaned off the milk. That is the talk. I hope that was informative and useful to people. If people have any questions, please go ahead and put it in the comment section. Thanks so much.
Wow, thank you, Dr. Stern. That was awesome. Lots and lots of good information. Again, I don't know about everybody else, but my brain's just bursting with information. There was one question when you referred to adding the hard pellets from another rabbit to the nest. Are you talking about the cecum, the night droppings?
No, they've actually been shown to eat the normal feces. So the mom will leave some of the normal, the hard, it's rather not the cicatrose, but the regular poop. They'll actually eat the regular poop. Obviously that's much, much easier to come up with than the cecal pellets.
Yes.
Most rabbit owners have plenty of poop around. Getting cecal pellets is hard. It's stressful for the donor. You usually have to put an e-collar on them. From what I've read, you generally start with the hard feces at day 8. If they're not doing well, if you have concerns, you could also offer them cicatrose, but you want to wait a little longer. I think it's like day 12 or something. You could try that as well, but it's probably not necessary for most of them.
Great. Okay. Let's see if there were any other questions. Everybody's saying very interesting. Thank you. Yes.
Yeah, baby bunny pictures are awesome.
Yes.
So someone asked, adult female New Zealand rabbit with an occasional nesting behavior. Is that a spayed rabbit? Would be my question to that. I don't know if the person can type. Sandy? Spayed. Okay, that is not normal. And so you probably either have what's called an ovarian remnant in your bunny, meaning that the entire ovaries were not removed and she still has some estrogen circulating in her body. Or some older bunnies, I don't know how old she is, but some older bunnies can actually get adrenal disease, and their body can start making sex hormones. So that's definitely worth investigating with your vet. Oh, I'm sorry. Yeah. Definitely, especially when you have bunnies that are been spayed by vets who don't do a lot of rabbits. I just had one a couple of weeks ago where we went in and there was still a little bit of ovary left.
Hmm.
It can be hard to get those ovaries out completely.
This isn't directly on this topic, but since we have you here,
Yeah.
in bonding rabbits, I've often been asked if the female is spayed, is it important for the male to also be neutered when you're trying to bond a new pair? And what would be your feeling about that?
I think it should, the male should be neutered too. Otherwise, he's really going to piss her off. He's going to probably be mounting her all the time, and she's probably going to get pretty annoyed.
So he would show that behavior even though she's.
Oh yeah, totally. Yeah, absolutely. In fact, he'd probably be relentless, and she'll probably be like, "Get away,
Yeah.
get away from me."
Somebody was asking about the best way to weigh your bunnies at home.
Okay, that's a good question. So if you had baby bunnies, you really need a gram scale and just small postal scales that you could get at Staples or at Amazon or something. They're not too expensive, and those work just fine. For a larger bunny, it's ideal to have a basically they would be like called a pediatric scale or an infant scale. Again, you can buy them on Amazon. They're not too expensive. The ones we tend to have at vet clinics cost a lot, but I've seen them on Amazon and they're not that bad. If you don't have that and you're in a pinch and you have a scale for yourself, what you could do is weigh yourself and then hold the bunny and weigh yourself again and subtract the difference if you're in a pinch. There you go. Perfect. Postal scale and a baking pan. Works great.
Creative people. Okay. Well, we'll wrap up then. Thank you so much for joining us this afternoon. Really appreciate all the information you shared.
Oh, it's my pleasure.
That was great.
All right. Bye, everybody.